We'll be finishing off this school year with lesson 7.2, how does the excretory system work? We have four main objectives. Um, Three of them are going to be very similar from our last lesson. So describe the structure and function, identify disorders or diseases, and explain how to take care of the system. And then we also have the second one, as you see, which you'll have to explain how different systems in our body work together to support each other. Big number one, the excretory system. First, let's look at the word excretion. Excretion means removal of waste from the body. So, based on this word, when we have the excretory system, it's going to be the group of organs responsible for removing waste from the body. For example, we have the kidneys, ureters, bladder, and urethra for a part of this system, and basically they expel any waste from the body that the body creates while working on different tasks. We have lungs and skin as our first category, although they're not part of the excretory system technically, but we do include them because they do expel certain wastes out of our body. For example, when we breathe, lungs are going to excrete carbon dioxide or CO2 so that we can get rid of those from our body. And also, our skin will excrete water, salt, minerals, and fats through sweat. So, when you sweat, it's going to create odor because bacteria on your skin break down the fats and it's going to create smell. Especially because you guys are growing and you are producing more sweat and hormones, it's very important that you wash frequently and thoroughly because, like I said, it's going to be easier for you to smell more just because you excrete more of these things through your skin. Our first organ is going to be the kidneys. As you can see, it's indicated with the arrow. You have two of them on either side, and their main purposes are to remove waste and excess fluids from the body and to maintain the body's water balance. What happens is that when blood passes through your body, it also goes through your kidneys, and they are going to continuously flow through the kidneys because each kidney has about 1 million filter units called nephrons, and these are surrounded by masses of blood vessels called capillaries. And because they are continuously filtering things, they're going to say, okay, these are waste, these are not. So they're basically clearing things out of your blood. And these wastes and excess water form urine as they pass through the kidneys. Ureters, urinary bladder, and urethra are all indicated with the same colored arrows with the title. Urethra is going to be the first item, which is going to be a narrow tube that carries urine to the urinary bladder. So once you have the blood circulating through the kidneys and they filter out harmful toxins, maybe wastes and different products, they're going to come through this passageways, and because you have two kidneys, you're going to have one ureter for each, so you have two of them in total, and they go to the bladder. So urinary bladder is going to be like a pouch. It's going to be a muscular organ where urine is stored until you go to the bathroom and empty them out. They contract to force urine out, and they're going to be involuntary muscle, which means it's going to work without you telling them what to do. Now, you may say, Ms. Pog, but we can control when we go to the restroom. It's because you train to have the sphincter to hold on to the urine so that you won't wet your sheets. But then if you think about it, when you're little, when you're diaper training, for babies, you don't really have any control for urine, so they just go whenever they want to because they have diapers on. But as you get older, you train yourself so that you can hold on to urine for a longer time so you don't have to change or you don't have to wear diapers all the time. Now, urethra is a tube that urine leaves the body from. It's going to be a shorter passageway, and females will have a shorter passageways than the males, and it is easier for males to hold on to their urine for that reason, actually. Now, big number 2 is on how do body systems work together. And actually, all body parts must work together in order to function. If you remember working on Guts and Bolts game, you have to connect so many different parts so that they can work together. We're going to take a look at the chart in the next page for all these different systems. So we have a chart, and let me tell you how we're going to read these charts. So we're going to go from top left, and then we're going to go down the chart, and then as we go down the chart, I'm going to go with the first item on the first row and then go to the columns and see what they do for each of those systems. So for example, we have circulatory, which is going to be the blood vessels. We are not going to have anything circulatory with the same circulatory ones because they're exactly the same. So we go to the next one. So whichever one that has gray fillings, we're not going to look at them. It's going to be the other parts. So for example, circulatory system would help the digestive system with moving the digestive nutrients to cells. Circulatory system would also help the excretory system so that it can move blood into kidneys, and kidneys can filter wastes. It will also help the respiratory system because circulatory system will transport blood with carbon dioxide to lungs so they can filter it and again put oxygen into different parts of the body. Digestive system will help the circulatory system by providing heart with nutrients so that it can beat, and it'll also provide kidneys with nutrients for the excretory system so they can filter blood, and with respiratory system it provides lungs with nutrients so they can inhale and exhale. So digestive is going to provide all these energy so that other systems of your body can work. The excretory system works with circulatory system because it clears blood of waste from both food and respiration. So blood is going to carry different waste, nutrients, and all of those things. For digestive system, excretory system will clear blood of waste from food because digestive system will also produce many different kinds of wastes along with nutrients. And for respiratory system, it's going to clear blood of waste from respiration. So basically carbon dioxide will be removed from the respiratory system. And the respiratory system also helps the rest of the systems because you need oxygen. So provide oxygen for the blood and removes carbon dioxide or CO2 for all of these different parts. And providing oxygen is very important because without the oxygen, cells can't function. So if you want your body to function, obviously you need to breathe. So all of these systems are going to work together. If one of them doesn't work properly, the other ones are also going to be affected, and they can cause you different types of illnesses and diseases. The third topic is disorders and diseases of the excretory system. So people with diabetes and high blood pressure are at higher risk of chronic kidney disease, which is going to build up waste, which can cause anemia, heart disease, bone disease, and even kidney failure. We call this also renal failure. It's a different word for kidney. And if you have a kidney failure, dialysis is required because your kidney is no longer able to filter those harmful wastes in your body. So when you go through dialysis, it's going to take about 2 to 3 hours, and you'll have to go in about 3 times a week so that you're making sure to expel all those water, salt and minerals and things like that from your body. And it is going to be very tiring and painful because imagine you're drawing your blood out of your body to go through a machine and you're putting it back into your body. And sometimes the balance of minerals and things like that are going to be um, undergoing drastic change, so your body is going to feel pain as well. The next item is cystitis. This is caused by bacteria, and basically you'll have inflammation of the bladder for different reasons. The most commonly known cystitis is going to be urinary tract infection, which is going to be also known as UTI. So when bacteria that have entered through the urethra cause the inflammation of your bladder, it's going to be called a UTI. And symptoms are going to be different for different individuals, but some of the most common symptoms are going to be frequent urination or burning sensation when you are urinating. If you have UTI, you can treat them with antibiotics, but you do have to be careful because, like we've learned, when you are using antibiotics too often, you may develop antibiotic resistance. So you may have to switch off to different medication if it prolongs for too long or if you have it too frequently. Females are more likely to have UTI than males because they have shorter tract for the urethra, so it's easier for bacteria to enter into your bladder and cause UTI or inflammation of different kinds. The next item is called gout. This is caused by high levels of uric acid in the blood system by consuming certain food with high protein. So uric acid is produced when you eat food with high protein or amino acid, and when they break down into smaller pieces, you have these acid forming. Now, you have urate crystals building up in your joint, causing intense joint pain and inflammation. And these urate crystals are basically crystals of uric acid. It can cause those buildup in different areas such as your big toe, your feet, ankles, hands, wrists, or knees. So it is going to be very uncomfortable when you have gout because those are areas that you use frequently. There's no cure for this disease, but you can regulate your condition by taking medications to prevent either flare-ups, or you can have medications so that you can treat the pain that you have. The last item is going to be the kidney stones. It's caused because you have either certain food or medication, not drinking enough water, maybe you have a family history of kidney problems, or presence of other kidney-related diseases. As you can see, you have multiple different causes, multiple different reasons. There's no one dominant way or dominant cause that you'll get kidney stones. And when we say kidney stones, it's not actual stones that you're going to have. These are formation of crystal from mineral and acid salt that form inside of your kidney. And it's going to cause great pain as they pass out of the body through the urethra. Now, if it gets stuck, you may have to take them out with a surgery, but they usually come out on their own. If they get stuck in the urethra, though, you have to break them up and remove it using different methods. You can use either sound waves or a scope or surgery, so you can take them out. The last part is to keep your excretory system healthy. The important part of this is to keep your blood pressure and cholesterol level within a healthful range, and this range may be different depending on your health situation. So you may have to ask your doctor what is going to be your healthy level. Just like any other disease prevention, it's important to get plenty of physical activity and eat healthful food. And especially for the excretory system, you have to reduce your sodium intake. So less salt and less processed food is going to be helpful. Also, try to maintain a healthy weight so that you can avoid type 2 diabetes. Like we looked into it, having diabetes can increase your risk of having kidney problems as well. Last but not least, drink plenty of water and urinate frequently. If you drink more water, it's going to increase the time that you're going to go to the restroom, and it helps you to expel harmful things or excess waste out of your body much quicker. The last page, you have the questions that you have to work on from page 286 to 7. 1 through 5, I have the questions here on the slide, and then from question 7 all the way to 16, I have a page attached with this post.